Hello, welcome back to my channel. My name is Yetunde, and in today's video I'm going to be sharing with you different options that you have when you have a miscarriage. If you have been watching my videos in the last 3 weeks, you would see that in this month of October I have been focusing on pregnancy and infant loss with special focus on miscarriages. And this is because, as I said in my first video, which you can watch here, I have only experienced miscarriages. A disclaimer, I am not a medical doctor. I'm speaking from my personal experiences. For a lot of people, miscarriages happen naturally. And when I say naturally, the body triggers the miscarriage by itself and it just starts to happen. In fact, for quite a number of women, it is that process that is triggered. That's how they know that something is wrong. There's a percentage of women who find out just abruptly nothing is wrong. You're not bleeding, you're not cramping, you're not spotting, no symptom, nothing. You go to the hospital, maybe your routine check, and then you discover. There are different ways you could have found out. When you get to the hospital, you're usually evaluated. Evaluation can come in the form of scan, a physical evaluation, blood work. It could be a whole lot. And when they're done, usually you're going to be offered, these options. Now, when you miscarry, for a lot of women, the baby doesn't necessarily come out, at least not all of the baby, or not at once. You have to expel the baby. I hate using that word, expel. Usually there are 3 methods. I have experienced all 3 methods, and the way I'm going to do this video is to tell you the pros and the cons of each method. Please, if you're going through a miscarriage right now, or you're still grieving and you're not ready to talk about it or hear about it, and you feel like any information surrounding a miscarriage, a child loss, a stillbirth, all of this stuff is going to be too much for you to bear, this is your cue to stop watching this video. The first one is what I will call the natural method. The natural method is just when your body expels the baby by itself. And like I told you, for a lot of women, how you find out that your pregnancy is no longer viable is by this expelling process. Some of us start to bleed. It could be spotting, sometimes it's cramps. So you have all of these things, it's happening to you, and then you go to the hospital. My younger sister had a miscarriage where she started to bleed, and we got to the hospital, and while we were waiting there in the waiting room, she passed the baby. So sometimes it is that fast. It happens usually when it is still very early. I'm talking about a 4-week-old, 6-week-old, 5-week-old pregnancy. The chances are, if that's when it stops being viable, you most likely will pass it naturally. Again, this is not what happens in every case. There are people who will still not pass the baby naturally. So usually when you find out, the doctor can give you the option of, do you want to wait for it to pass? Because especially if you started bleeding and maybe there's been like considerable bleeding already, so you bled a lot by the time you landed in the hospital, and so when your doctor takes into account the amount of blood or blood clots that you've passed, and vis-a-vis the age of the pregnancy, they can usually be like, it's just a little that's probably left there, let's allow her pass it. And when the ultrasound is done, they can check and see, maybe you're almost empty, like they can hardly see anything. So they'll be like, okay, just wait it out, come back in a week, in a few days, and then we'll check again. For me, the pros of passing the natural way is always going to be that it's non-invasive. If you're a first-time mom and this is your first rodeo and you're experiencing this kind of thing, number one, I'm really sorry that this is how motherhood decides to welcome you. But if it's happening to you for the first time, you're not used to, the prodding, the putting hand, every touching, all the physical exam. Maybe you've never even had a surgery done before, nothing. The natural way might be appealing to you because nobody is touching you. It's not invasive. Nobody is opening up your cervix. They're not putting a probe in there. They're not, all of the stuff that happens behind closed doors. It just comes easily. You cramp, it comes out. You stop cramping, you cramp again, it comes out. that can be the method for the process for you, and that's kind of easy compared to the other two methods. Now, what I don't like about the natural method, it might start and it might not finish. Like, you might start passing the baby, and the next thing you know, something is stuck there, and then you go back in a week and something is still there, and then you have to now resort to the other two methods. And sometimes, you know, because you want to move on quickly from what has happened, it can become tedious for you, because now you've just extended the time that you spend in this, you know, pain, you know, unnecessarily. So sometimes it's not successful. Another reason that I don't like the natural one is sometimes it presents like everything has been passed, or you can just leave one small tissue behind, and at times they won't even catch it on the ultrasound, and then at a later date it's going to cause problems for you. You could run the risk of an infection. Now, because some women, it takes them a long period to pass. It could be a week or more. In that period, your cervix would maybe open a little, depending on the woman, and you can become susceptible to infection. The next method is medication. Now, medication is usually prescribed in the hospital, again, mostly for early pregnancies. The thing about medication is that it's usually will be given to you, maybe you've not even started passing. Maybe you came for your routine checkup, and then they do a scan and they can't find the heartbeat, or they can't see the fetal pole, they can't see this and that, whatever way it ended, then they will give you the medication. Sometimes too, maybe you started passing naturally and it's not looking like everything is cleared out, and it's not clearing out, you might be offered medication. And the medication, I'm not going to mention the name, I'm not a doctor, so I'm not going to be prescribing medication on my channel. If you have this type of issue, I strongly suggest that you go to your doctor, please. This is not a doctor, I'm just sharing my experiences. So the medication, the common one, there's a 2-dosage medication. There's one to kind of ripen the area and get things, you know, ready, and then 2, that's what's going to now cause the expelling. And when I say cause, first con about this medication that I don't like is the pain. You would have contractions, cramps, stuff happening to you. I don't know how else to explain it. It's just going to be happening. It's like when they induce labor. The induced labor is more painful, and it's because, you know, it comes in quick successions. That's the exact way that this medication works. But the pro about the medication is sometimes it helps you to kind of manage yourself. You're able to kind of pick a date. I remember the first time I was given medication to use, my husband was out of the country, and so I'd called him to see what happened. I was telling him this is what they've said, and so he had to quickly book a flight to come back home. And so I waited for him because I didn't want to, at the time I didn't want to we didn't tell our parents, and I didn't want to I didn't want to go through it alone, so I needed him to come home. He was going to arrive in like a couple of days. Again, I was also able to take some time off work, so that's the good thing about like the medication. You can plan yourself. You can, you know, plan when you want to take it. You literally, because you know it's taking like after a few hours after the other, you literally could say, okay, I'll take the first one at 7 p.m. and then I'll take the second one at so time. You can time it. You can decide to do it overnight. So it kind of gives you some level of flexibility, and it helps you to plan. You can be in your house. Usually they give you the medication and send you home, so you can be in your comfort zone in your home, you know, with all your pillows, how you want it. You know, you can light candles, you can make it a whole thing. In fact, you can decide to check into a hotel and just, you know, get it done there. Maybe you have little kids and you don't have the space and whatever you need, you can decide to go to your mommy and go and, you know, take the medication there. Medication gives you that flexibility. The other downside to medication is some babies are stubborn. They will still not pass fully with medication, especially if the pregnancy is a bit older. And when I say older, I'm talking about from like 9 weeks-ish, 10 weeks-ish. Sometimes you will drink that thing, you will pass some, you will be in horrendous pain, you will bleed, You think everything is over, boom, it's not over. You go for your checkup, they're like, oh, we still have something in there. So the last method, surgery. You'll be offered surgery if your baby is a bit older, if the pregnancy is a bit older, if you're, you've leaned towards that 13 weeks, 12 weeks, 14 weeks area. No, it's surgery. Even me, I would advise you to just get the surgery done because the baby is already bigger. The pregnancy is, more farther along, and the chances are you might get stuff left in there if you decide to go the natural route or medication route. It's quick and it's fast. I mean, they go in, they're out. 20 minutes, they're done. Even less at times, depending on how far along you are. They just go in and, they clear you out. The bad part is it can feel impersonal. It could send you into like a spiral of, oh God, is that it? Because you sleep, if they put you under, you sleep pregnant, you wake up and the baby is gone. There's no in between. You don't even see it happen or feel it happen. Some of us, we want to feel it. You want to actually, feel it because it's part of your healing. So if you're that kind of person, surgery will not work for you. You wouldn't like it. You wake up and you might actually feel some, sense of, it's like you're hollow. If you're someone who maybe you've had surgery before and you don't do well with anesthesia, yes, you will not like surgery because when you wake up or when you're done, you still have to deal with the after effects of that. If you're someone who is trying to start trying immediately, surgery ends everything quicker. The bleeding you get after surgery usually doesn't take time. You stop bleeding, in days. Maximum like a week, you're done bleeding and you can move on. This is for people who are dealing with infertility. If or you have fertility concerns, sometimes they want to take some tissue from your baby if you had a loss, and it's just to do some analysis in the lab. And so the regular D&C, which is the surgery that they do, might not work for you, at least not at first. So I have a friend who has gone through this. One of the major causes of miscarriage is a chromosomal abnormality. I hope I'm saying it correctly. It just means that the baby did not get the complete number of chromosomes that a baby should have, so your body would expel the baby. Now, if that happens to you, more than 3 times, there would be some investigations that will be recommended for you, some tests. One of the such tests is to take a sample tissue and test it for the chromosomes. I think it's called hysteroscopy. If you're being treated at a fertility clinic or fertility center, this is the kind of thing they would offer to you. If it's not offered to you and you want to do further investigations, you can ask for it. I prefer the D&C, and the reason I prefer the D&C is because honestly, the time I was on my 3rd miscarriage, I was mad at the world, I was mad at my body. My first miscarriage did not help me. My first miscarriage was prolonged. It took about 2 months for me to get out of it, and by that time I was already depressed from losing the baby. Then I was depressed again because I couldn't just get my good health back. So anything that would prolong the whole process for me, I'm not a fan. So I would choose surgery any day. Again, your situation is going to determine the kind of treatment you'll be offered. It is important that you sit with your doctor and talk about the different methods so that you guys can choose what is really going to work for you. Now, to close this video, I just want to talk about just some few things that sometimes your doctor will tell you. Doctors generally will say about a miscarriage, and they're just not true. The first one that they told me, I remember, and it freaked me out when I had my first miscarriage, was, oh, it was just gonna be just a little bit more painful than period pains, like menstrual cramps. Is a lie. It was more painful than that, and this was when they gave me medication to expel. They went and told me that they told me that it's just a little bit more painful, so they gave me ordinary paracetamol. If your pain threshold is not high up there, in fact, you should start a pack. As they're giving you medication, collect correct pain medication. Ask for it. because I am telling you, it is painful. They say it's like when just a little bit above period pain. That's a lie. It is very painful. You're expecting something that you just be okay. Next thing, you're doubled over at home in serious pain and no way to relieve your pain. So please make sure you get the proper pain meds from the hospital. Don't go and buy over the counter. I suggest you ask your doctor for pain medication. The second thing that at times doctors will tell you is they'll tell you, when you say, oh, so when I start to pass the baby, what's the going to look like? We're like, it's just a little bit heavier than period blood. That's another lie. Nope, it's a lie. More often than not, and I mean like 90-something% of the time, you're going to pass a lot of blood, more than your normal. Except you're someone that has very heavy flow. Like, even if you had very heavy flow, you're going to pass clots, you're going to pass tissue, especially if you're a little bit more farther along. And so you're not prepared, especially if you're a first timer, and then you sit on the toilet, this thing plops out of you, boom, and then you're scared and you're afraid and you're thinking maybe your organs are falling out. No, it looks scary, so you have to be prepared. Especially if you just don't want to mess everywhere up, I would suggest that stay in a room that is en suite, where you can just have access to the bathroom easily. If you use shower curtains, remove it so you don't stain everywhere. And then if you're using pads, don't use the normal flat pads. These pads, flat pads with wings that you use for your regular period. Go and buy cotton pads, the ones that are bulky, those fat ones. I'm going to put a picture up here. There's this very popular one, Comfort. That's the one they usually give us in the hospital here in Nigeria when you have a baby. Very big pad ones. I saw a video here on YouTube where for hers, she had to wear adult diaper because the padding was much more thicker. So sometimes that's how much protection you need, so you don't bleed all over the place. Another thing I want to say is have someone with you. Like, even whether you're not married or not, if you're married, don't do it alone. So especially if you're going to do it at home, even if you're leaving the hospital after the surgery, it helps to have someone around. You might honestly, not because you're not physically able to do it, but you might just want to just stay in your room or just lay down somewhere and not do anything for a while. So it helps to have someone around to help you out with this and that. And finally, there isn't one way to feel when you're experiencing something like this. I have met women who have told me that yesterday I didn't feel too sad when I lost my baby, and now I feel guilt because of how I felt. We all have different thresholds of when it comes to our feelings and our emotions. Some people are crybabies, some people are not. Some people feel things more deeply than some other people. Sometimes, depending on how your situation is, you feel relief. I told you, I had a pregnancy that I was just relieved. That was the first feeling. Own your feeling. You're going to be okay. Yes, it's scary, it's sad. I don't wish it upon anyone, but it does happen, and you're not the only one. And what can you do when something happens to you, especially something so sad? You have to find your joy and your happiness one way or the other. You can't let it consume you. And on that note, I want to say thank you for watching this video, and thank you for coming on this uncomfortable but very necessary miscarriage and pregnancy and infant loss journey. It's something I've always wanted to talk about. I just wanted the right time to talk about it. So I'm going to be back to my factory setting of preppy videos, I'm sure, in the next video. So if you have comments, if you have things that you want to share in the comment section, please don't forget to leave me a comment. Share this video. You never know who might need it. Don't forget to like, don't forget to subscribe to my channel. Guys, I need to hit 1,000 subscribers very soon. Thank you so much for watching. I'll see you next week. Bye bye for now.